Alrighty, welcome back. So once again, I'm Dr. Chaudhry of the Foot and Ankle Wellness Center, and what my previous video was about bunions, what they are and what are the top causes of bunions. And now I want to talk to you about the top 5 treatments for bunions. This is something that's very important and something that my patients ask me all the time. So let's get started. Now, one of the number one treatment, well, let's just say it's not the number one treatment, but one of the treatments is wearing a bunion splint, like a digital splint. It's something you can get from the drugstore. You strap it on to your side of your big toe, wrap it around your foot, and it kind of splints your toe straight so it doesn't keep going that way. And that can help as long as you're wearing it. It allows for some padding, some cushioning, and it allows the toe to be a lot straighter so it doesn't crowd that second or third toe. And that is very, it's not a cure, but it is something that allows you to be able to be comfortable at least for a while. Okay. The second thing is orthotics. Orthotics are custom molded biomechanical devices, and what they do is they help to allow your foot to walk in a more normal, straight manner, to be able to put less pressure on the foot, and namely in this case, a bunion. Now what an orthotic does is to help slow the progression of the bunion so it doesn't become so advanced over time. I'm actually a witness to that. I've been wearing orthotics since 1990, over 23 years ago now, and I can guarantee you that my bunions are no worse than they were back in 1990. Once in a while they have hurt, but so far the orthotics have kept them in check. Alright? The third thing we can do is to wear wider shoes. Now, remember what I talked about in my first video, where if you wear a narrow shoe and you got a foot this wide, it's going to put a lot of pressure on that side? Well, if you wear a wider shoe, you won't have as much pressure. That helps to alleviate the tension on the bunion and allows you to be more comfortable. The fourth thing in regards to bunions is padding. You can get pads from the drugstore. Your podiatrist can have pads that you can apply and hook it onto your foot, kind of like splinting or wearing wider shoes, but it helps to give you more cushioning and essentially relieve some of that tension on that area, because when the bone's sticking out so much, if you put a little pad on it and then you wear the shoe, it won't be as tender or as prominent. However, number one treatment for bunion surgery, hands down, is through surgery. It's the only way you're really going to truly get rid of it. A podiatrist is very skilled in doing forefoot surgery, and they are probably the best in doing bunion surgeries too. So I would say if all of the other treatments aren't helping you, splinting, wider shoes, padding, orthotics, you're still having a lot of pain, it's not getting any better, don't waste any more time. Go in to see your podiatrist, get that surgery, get it fixed, and you'll be really glad that you did, because it's a very successful surgery. And if you've had horror stories, if you heard horror stories about it, we can talk about that, because it really doesn't have to be like that. There's a lot of different procedures now that can be done minimally invasive. That means you can get back on your feet a lot faster. That's another topic for another day, but those are the top 5 treatments for bunion surgery, for bunions. Thank you.